You've just noticed something you never imagined you'd see: blood in your semen. Right now, your heart is racing, 1,000 thoughts are rushing through your head, and you're wondering if this could be serious, if it's cancer, if your intimate life is over. Take a deep breath, because in the next few minutes, I'm going to explain exactly what might be happening, when it's actually cause for concern, and most importantly, what you should do right now. I'm Dr. Amelia Tiller, and here on Male Secret 60 Plus, we talk openly about everything that affects the health of the mature man. No taboos, always backed by science. So stay with me until the end of this video, because the information you're about to receive can literally change how you face this situation. Before we dive into the technical details, I need you to understand one very important thing. The presence of blood in semen, medically known as hematospermia, is much more common than you think. Studies show that about 1 in 10 men will experience it at some point in their lives, especially after age 50. And here's the news that should already calm you down. In the vast majority of cases, it's a benign condition that resolves on its own and is not related to anything serious. That's right. Most of the time, it's not cancer, it's not a severe sexually transmitted infection, and you are not going to lose your ability to have a healthy, intimate life. But pay attention, I said the vast majority of cases. There are specific situations where this blood can be a warning sign that requires immediate medical investigation. That's exactly why you're here, to learn how to tell the difference, to know when you can relax and when you need to seek professional help as soon as possible. Because knowledge is power, and when it comes to your health, you deserve to have all the facts. Let's start with the basics. What exactly is semen, and why can blood appear in it? Semen is a complex fluid that doesn't come from just one place in your body. It's produced by several different structures. The testicles produce the sperm. The prostate contributes about 30% of the volume and adds important substances for sperm nutrition and motility. The seminal vesicles, located behind the prostate, contribute around 60% of the total volume, adding fructose and other substances that serve as energy for the sperm. The bulbourethral glands produce a lubricating fluid. Imagine this system as a network of interconnected tubes and glands. Any small bleed anywhere in that network can result in blood in the semen. It could be a tiny blood vessel that ruptured during intimacy, inflammation in one of these glands, an infection, trauma, a ruptured cyst, stones in the seminal vesicles, or, yes, in rarer cases, something more serious like a tumor. The first thing you need to know is that the color of the blood can give important clues. Bright red blood usually means the bleeding is recent and likely coming from somewhere closer to the exit, like the urethra. Darker brownish blood suggests older bleeding or bleeding from deeper structures, like the seminal vesicles or prostate. Now let's talk about the most common causes. Number 1 cause, especially in men under 40, idiopathic, meaning even after a full workup, no specific cause is found. It probably happened due to minor trauma during intimacy or even spontaneously, and it resolves without treatment. Frustrating not to have a clear answer, I know, but reassuring that these cases usually have no consequences. Number 2, most common cause, infections and inflammation. Prostatitis, inflammation of the prostate, is extremely common in men over 50. It can be bacterial or non-bacterial, related to urinary flow issues, pelvic muscle tension, or even stress. When the prostate is inflamed, blood vessels become fragile and can bleed easily. Other signs of prostatitis: pain or burning when urinating, frequent urination, pelvic/lower back/perianal pain, sometimes fever if bacterial. Seminal vesiculitis, inflammation of the seminal vesicles, has similar symptoms, but may also include pain during or after intimacy. Sexually transmitted infections, chlamydia, gonorrhea, herpes, can also cause blood in semen, so if you've had recent unprotected exposure, that needs to be checked. Other important causes: trauma, even vigorous intimacy, very frequent masturbation, recent prostate biopsy, digital rectal exam, urinary catheter, or sports like cycling, motorcycling that put constant pressure on the perineum. After a prostate biopsy, up to 70% of men have blood in semen. It can last up to a month and is completely normal. stones, calculi in the prostate or seminal vesicles, blocked ejaculatory ducts, cysts in the prostate or seminal vesicles, vascular problems, especially in men with poorly controlled high blood pressure or on anticoagulants, warfarin, high-dose aspirin, etc. Now, the elephant in the room, cancer. Yes, prostate cancer can cause blood in semen, but I need to be crystal clear. This is rare, especially if it's your only symptom. Studies show less than 4% of hematospermia cases, all ages, are linked to cancer. The percentage rises slightly after age 40, but it's still low. Prostate cancer usually comes with other symptoms: difficulty urinating, blood in urine, bone pain, if metastatic, unexplained weight loss, elevated PSA. If blood in semen is your only symptom and you're under 40, the chance of cancer is extremely low. That said, men over 40, especially over 50, should always get evaluated when they notice blood in semen, if only to rule out cancer and have peace of mind. I'm not trying to scare you. I'm empowering you to make the right decision. Rarer causes: genitourinary tuberculosis, schistosomiasis in endemic areas, congenital vascular malformations, blood disorders, amyloidosis, etc. So what should you do when it happens? Don't panic. Easier said than done, I know. Panic won't help. Observe and take notes. When did you first notice it? Once or multiple times? Color? Any other symptoms? Pain? Fever? Urinary problems? Blood in urine? Recent trauma procedure? Anticoagulant use? Risky exposure? If you're under 40, it was the first time, small amount, no other symptoms. You can wait a few weeks and watch. In most cases, it stops and never returns. Avoid vigorous intimacy for a few days, limit alcohol, caffeine, stay hydrated. Seek a doctor immediately if you're over 40. Bleeding is persistent, recurrent, abundant, severe pelvic abdominal pain, fever, chills, urinary difficulties or blood in urine, family history of prostate/other urologic cancers, unexplained weight loss/extreme fatigue, you're on anticoagulants, or you're simply very worried and want certainty. What will happen at the doctor's office? Detailed history. Physical exam, including digital rectal exam. Yes, it's quick and essential. Urine test plus culture. Blood test for PSA, usually in men 40. Transrectal ultrasound to look at prostate and seminal vesicles. Pelvic MRI or cystoscopy if needed. STI testing if indicated. Treatment depends 100% on the cause. Bacterial infection. Antibiotics, 2 to 6 weeks. Non-bacterial prostatitis, anti-inflammatories, alpha blockers, pelvic floor physiotherapy, warm sitz baths, large symptomatic cysts, stones, rarely surgery. Cancer depends on type, judged stage, surgery, radiation, hormone therapy, active surveillance, idiopathic, observation only, emotional impact, and relationships. Seeing blood can be terrifying and cause anxiety, performance fears, or avoidance of intimacy. Talk openly with your partner. Most are understanding and supportive. If needed, see a therapist or couples counselor. Stress and anxiety can worsen symptoms and create a vicious cycle. Prevention tips: good intimate hygiene. Condoms with new casual partners. Avoid excessively vigorous traumatic intimacy. Healthy prostate diet: lycopene-rich tomatoes, zinc, selenium, omega-3. Maintain healthy weight, exercise regularly, no smoking, limit alcohol. Annual prostate screening starting at 50 or 45 if high risk. Myth busting. Myth: blood in semen always means cancer. False: most cases are benign. Myth: if it doesn't hurt, it's not serious. False myth: one episode that stops. No need for doctor, only true if young and no risk factors. Myth: hematospermia causes infertility, usually false. Myth: long abstinence causes blood in semen, no evidence. Real patient stories: anonymized, 58-year-old convinced he was dying. Bacterial prostatitis, cured with antibiotics, 42-year-old post-biopsy panic, completely normal, resolved in 3 weeks, 67-year-old who ignored it for 6 months. Advanced prostate cancer, much harder to treat. Age-specific notes: under 35, usually idiopathic trauma, STI. Conservative approach 35 to 50, rising prostate-related causes. Over 50, full investigation recommended, cancer risk increases. Over 70, also consider vascular issues and polypharmacy fertility. Hematospermia itself almost never affects fertility. Only severe untreated infections or obstructions can, temporarily. Final message. Seeing blood in your semen is scary, but in the overwhelming majority of cases, it is not serious. The key is don't ignore it, especially over 40 or if recurrent. Get properly evaluated, follow medical advice, and maintain healthy habits. Taking care of your health isn't weakness, it's wisdom. You deserve to live with quality, peace of mind, and full vitality. If this video helped even a little, please hit like. It helps us reach more men who may be suffering in silence. Subscribe to Male Secret 60+, turn on notifications, and share this video with a friend, father, brother, or uncle who might need it. Leave your questions or anonymous experiences in the comments. I read every single one. Thank you for watching until the end. You're not alone on this journey. Take care of yourself. You deserve it. See you in the next video. Big hug, Dr. Amelia Tiller.